reality. I'll back up just a little bit for your recording. We mentioned the third phase of power about changing public narratives and how we make sense of the world. So, what are narratives? Narratives, the textbook definition for you that we have is narratives are values-based themes of stories that determine how we interpret reality, about how and why the world operates, that have the ability to shape public consciousness, including our collective senses and responsibility and possibility. And this quote from Baldwin is the one that I refer to all the time. And actually, I have a wonderful frame now with that quote that sits on my floating shelf. Um, but it really encapsulates why shifting how people see and understand reality is also the root of enacting change. The world changes according to the way people see it. And if you alter even by a millimeter the way people look at reality, then you can change it. And so let's swim in this ocean really quick. We like to show this image because it shows us the relationship among worldview, narrative frames, messages, actions, and policies. The deepest part of the ocean of our thinking is at the level of our values and worldviews, how we see the world. These form the basis of our narratives, whether they are narrative centered on individualism or interdependence. Narratives are then communicated through messages and stories that we tell, and the underlying narrative acts as the frame or lens through which we communicate messages and stories. The narratives get translated into specific messages, whether they are messages like pull yourself up by your bootstraps or, as the famous quote by Fannie Lou Hamer says, no one is free until we all are free. So, narrative is not just a product that you drop into a press release, it's the underlying set of values and worldview that informs how you do your work. It undergirds what we do. It informs communications, yes, but it also informs our strategy, the culture we set, who we partner with, how this contributes to a movement, what we advocate for, and how. So people are operating on narratives every day. So this is just an opportunity to actively change the narrative from the status quo to different narratives that support health and social justice. And remind me to also, I can share with you a few resources, concepts, and definitions, and I'll send you that link after this. And so the problem, dominant narratives limit our ability to expand our public health ecosystem, promote healthy communities, and advance health equity and justice. And the first step to narrative change is identifying dominant narratives. What are dominant narratives? I keep talking about them and I have not given you a definition. So, dominant narratives are those held by many people at a moment in time. They are everywhere. They guide our thoughts, actions without us being aware of them. They are embedded in our institutions, structures, and norms, our policies, systems, laws, and culture. Importantly, dominant narratives are created and they are naturally occurring or innate. Dominant narratives are drawn from and perpetuate the values and beliefs of those in power and a reigning social structure. There are a set of dominant narratives that limit progressive change and limit the solutions we are considering. And we call these harmful dominant narratives or simply harmful narratives. You'll see all of this lingo going back and forth in the field. But when it comes to the emotional impact of people, they are more powerful than facts. And the past 10 years have shown us that in alarming ways. Checking the chat. And yes, I will have time for questions as well. Over the last 40 and 50 years, a set of narratives based on a neoliberal worldview have become dominant. There was a purpose to wanting people to think this way. It benefited a small number of powerful elites, and it hurt many people. And some narratives that are dominant in the society today include individualism, anti-government, free market. Individualism, that we're all on our own, that collective society has no role to play. Anti-government, the narrative that government is inefficient and wasteful, and it'll always be that way. Or that free market will take care of all of our problems, that we should exchange our health, labor, and planet for economic growth. And those are all tied together with narratives that center and support racism, white supremacy, patriarchy, and other systems of oppression. And all of this is meant to divide us, right? So we are seeing how these narratives are showing up today, whether it is the need to cut essential services and public health programs and research under the notion that this is the way toward an efficient government. But we are all affected. And it doesn't matter if you're Black, Indigenous, Asian, or white. It doesn't matter if your community is urban or rural. In fact, a bulk of funding, federal funding for rural communities, comes from federal dollars that were slashed, right? So, as you see in the headlines, there are assumptions being made that taking a corporate mindset and letting the free market solve problems that affect human lives and livelihoods is the way to go. But is it? And so, we have to remind ourselves that maybe it's not the free market that's going to solve our problems, but maybe we are the ones that we've been waiting for. So this means that we have to elevate a different set of narratives that can cut across public health policies, initiatives, campaigns, our research data and programs, our agencies and partners, um, in understanding how health is created. We need narratives that are so pervasive that we can internalize them and they become the new dominant worldview. And this worldview should then signal implicit understandings of what we all deserve, what's allowable, who is worthy for health, and what and who we value. And as we think about democracy and how that has been front and center, we can also vocalize what we want our government and society to do as a tool in response of our collective will. And we can also beg the question of what do we want government to do? What do we want our structures and systems to do for our people's well-being? We also beg the question of how do we call in a larger we? So I'll pause here for a minute to see if there are any questions. I also like to get a little sip. For some reason, I got a little cough, people. Okay, so we can see dominant narratives in our ability to prevent and contain measles outbreaks, reduce racial health inequities, regulate corporations harming health, and maintain public health systems. Excuse me, people. I have a little cough. Happening while I'm being recorded, but okay. So, alternatively, because dominant narratives were created, we can elevate a set of values that open up the possibilities of many other solutions. These narratives are called transformative narratives. And one example that I mentioned earlier was around interdependence, or that famous quote, no one is free until we all are free. So another example of a transformative narrative will elevate messages like the role of government should consider all collective well-being, and we should have a part in informing decisions that affect us all. Or another one would be everyone is worthy and should be treated with dignity, respect, and with love. So we have the power to shift dominant narratives to more transformative ones. And we believe that dominant narratives, especially harmful narratives, can be undone and retold just like they were created by people. So the process of shifting dominant narratives to transformative narratives is called narrative change. So Miriam Kaba coined the phrase hope is a discipline. In one interview, she stated, I don't have hope, I do hope. It's an active process that I commit to daily. It's not an emotion, it's a practice, and it helps you navigate difficult times, just like this cough. Narrative work is one way we cultivate hope. Narrative change is a mix of both science and art that shifts our practice to hope. It is more than strategic communication again, but changing narratives is an organizing tool. This process helps us to name what we want, what we value, to organize around core values and agendas, to interrogate the status quo, to not be satisfied by that, so that we offer new possibilities. It's long-term strategy work, and it changes the trajectory of what's possible for a lifetime and generations to come. So by understanding and being intentional about how we use and change narratives, we can build hope within ourselves, our organizations, and within our communities. And as we practice hope, we then can wield our collective power to create the future where we all can thrive. And also, as questions come up, feel free to roll them in the chat, but I should be wrapping up really soon, but I do want to give you a few steps and then also a few examples, and then we'll take about 15 minutes for questions. So our goal together is to elevate narratives that reflect shared values and beliefs that shape a different vision of our lives together and what is possible, and to realize a world that reflects our values and beliefs and the big changes we said that we wanted. We need to engage in this arena of power and understand it in context of other ways in which we build and wield power. So the first step in shifting narrative is to clearly name and pull back the veil of dominant narratives. We have to uncover and elevate new ones. And as we're elevating a new set of values and narratives that we want people to share with us, we're offering a contrast, but we're not offering an argument. And so let me now give you a few examples of what narrative change looks like. So in the past decade, narratives about criminal legal systems and systemic racism have been shifting. And this shift is due to decades of Black-led organizing that produced a contemporary movement for Black lives. So here on the left, you see all these blue spikes in the chart. Those are the volume of tweets that included the hashtag Black Lives Matter over time. And what are the narratives of Black Lives Matter conveying? It was popularized in response to how policing has violated the value of Black people's lives. But Black organizers and movement builders use focused attention on policing to open conversation about racial justice and structural oppression more broadly. And so, as you see on the right, hopefully, Fingers and toes crossed. There we go. You'll see the shift in narrative has had a dramatic impact in our country. So this is Pew polling data, which showed the shift from 2014 when the movement took off, and the country was equally split on whether we needed to do more work around equal rights, or in 2015, when you see after that explosion of the movement, the mass action in the streets, the posts, the social media, the news, the stories, and so on, you see that a major shift in people's views about the work our country needs to do to ensure racial equity. And more recently, we've also seen a shift in how that led to policy debate focused on police funding. This shows the power of narrative change, but I have a couple more examples for you. And so here is one around maternal health. So it's fairly widely known now that Black and Brown women have worse maternal health outcomes than white women. The main solution has been to encourage individual prenatal care. But when the maternal child health field figured out that individual level prenatal care was not solving the maternal health outcome gaps, they realized that the problem was much bigger. Research showed things around class, education, um, etc., that the gaps still exist. So the field was forced to shift thinking from individualism to more systemic. And so to start looking at the conditions, start looking at how racism and structural racism played into those systems, whether it's hospital policy, physician behavior, to look at real progress. This is also a narrative shift, right? And relatedly, one of our partners, population health improvement partners, who is also involved in Narratives for Health, their Forsyth County Birth Stories project in North Carolina involves bringing mothers in that county together with obstetrics and gynecology healthcare clinicians to share their birth stories in order to identify opportunities to improve birth outcomes for Black and Brown residents, shifting narratives to focus on systemic change. One last example for you, one that you're probably the most familiar with. Many of you witness one shift in mental health and public health fields when we started focusing on trauma-informed care. Before the language of trauma-informed care and trauma-informed communities, society would focus on what's wrong with you. We saw policies related to punishment and penalty, especially when it came to Black and Brown students. But in the late 1990s and early 2000s, we were introduced to adverse childhood experiences, or ACEs, and trauma-informed care. We knew that trauma could get under the skin, and the field began to quantify those experiences into ACE scores. But we also began seeing stark, disparate impacts of ACE scores in Black youth. We began shifting our language from what's wrong with you to what happened to you. And so we had to unravel what was going on within the conditions in which we lived. So talk to me in the chat. What changes in processes and policies did you see in the shift of the question from what's wrong with you to what happened to you? What changes did you see when communities in the field focus on trauma-informed care? If you have examples. And as that rolls in, the narrative shift that trauma-informed care brought along moved us from individual approaches and the blame game to looking at systems, and begged us to look at how those systems are intertwined to take care of us. Right. Had more discussion of systems and communities. Right. So, changing policies for youth to receive support and restorative care instead of penalty, making sure wraparound services were embedded. Right. Communities began to look at resiliency as well. Correct. We started to um, look at the stigma of mental health services, treating whole families and communities instead of solely focusing on individuals and individual behavior. And now we're also seeing this shift around issues like loneliness and understanding the need for socially connected communities and how this is also affecting our well-being, right? So our health is so much more than health care or sick care. In the last couple of decades, we have broadened the definition of health, even at county health rankings and roadmaps. And so we're knowing now that the experiences like trauma, loneliness, structural racism all impact our health. That's narrative change. So let's get move these next slides a little quickly and then we'll move to questions. Those shifting narratives takes infrastructure or shared understanding relationships and alignment of resources and time. Narratives for Health has a particular emphasis on centering hope and shared values through our narrative process that you see. But it really emphasizes relationships, starting with the relationships that you have to build shared understanding, to expose dominant narratives, to elevate and craft shared values that you can then organize and apply to your work. We've engaged, I think, over 2,000 folks now, whether it's like introductory, what is narrative sessions like these, or through large train the facilitator sessions. And so we've seen people apply narrative in everything that they do, and you can too. Whether it's understanding like how to change your organizational structure. We've supported public health, healthcare, community organizations to shift power through narrative change with these practical and transformative steps to change culture, but then also into um, things like policy recommendations or community and state plans and briefs. We've also seen people use and apply transformative narratives to engage their media, to also change how they conduct research and evaluation. So you can find all of these examples at narrativesforhealth.org and in our in action resource. And you can also find all the other resources that we have on that website. So narratives, they can help frame data, inform your strategic communication strategy, shift how you shape agendas and policy briefs in your training, strategy programs, you name it, you can use narrative and apply that to your work. We also, to note, have a Train the Facilitator session that's coming up in September of 2025, if you are interested in that. So I have a 5-minute video and then I'll open it up or 4-minute video, and then we can open it up for questions.
Even before our first breath, those anticipating our arrival begin to draw the outline of our lives. We enter the world as blank canvases, friends and family lovingly imprinting their most sacred stories into us. But the stories of loved ones aren't the only ones that shape us. We're also influenced by stories and beliefs passed down from historical systems of oppression, telling us how the world works and our role within it. many of these beliefs go unquestioned and unnoticed, forming a lens through which we see the world. When it comes to health, we are shown a narrow view.
This is your brain on drugs.
An apple a day keeps doctors away.
I'm not comfortable with government-run healthcare.
And often, the field of public health has championed this too. That health is in our hands alone. That medicine and changing our behavior are the best ways to address health problems. That what we eat, where we live, and how we spend our days are free choices, and the only things that matter for health. But from this individualistic view, the ways we're told to be healthy are inadequate at best and harmful at worst. Putting blame on our communities, who are already struggling because of multiple systems designed to harm and exclude us. When we as the public health community don't pay close attention to the stories we tell, we may unintentionally reinforce the very systems harming our health in the first place. Because the narratives we've been taught about our health have been created and reinforced by the same corporations and institutions who benefit from widespread illness and poverty. By convincing the masses we are solely responsible for our fate, these institutions have rationalized the status quo of injustice and hidden their actions to pollute, poison, profit, and hoard power while denying people basic needs and care. We know there's more to the picture. The environmental, economic, and social conditions in our neighborhoods. The written and unwritten rules, decisions, policies, and practices that shape these conditions. And the underlying systems of oppression that perpetuate them all along. This wider, clearer view of health has helped us expand the horizons of our field, what we consider a health issue, the strategies we employ, and the solutions we imagine. Over time, we have broadened and sharpened our own view of what creates health. Many across public health are pushing back on harmful narratives by offering a new narrative where change is possible. We know it's possible for all of us to have what we need, not merely to survive, but also to thrive, building our collective power to win solutions that make vibrant health a reality for everybody. Narrative is a form of power that we need to understand and learn to use in our efforts to achieve health equity. Because in order to shift the balance of power towards a world where everyone can thrive, we need to make our vision and values the new norm and organize to fight for the changes we seek. Together with communities most impacted by health injustice, we are sharpening our skills to boldly reframe what a healthy and just world means and requires. Join us as we create, amplify, and use narratives that raise the visibility and grow the viability of community-led solutions for health equity. Let's continue rewriting the story of our health, our field, and our future.
That's a wrap, everyone.
A summary slide. It doesn't play again, otherwise I'll stop the share and stop the video. And so the narrative is a arena of power. You can wield this power into your work and apply it into everything that you do. Because narrative work is more than what we say, it is what we do. And it takes time, resources, and focus and organizing to shift dominant narratives into the world that we want as we practice hope together. So with that, I will stop my share. And if you have any questions, feel free to put them in the chat or come off mute.
Thank you so much, Angela. I had a question. So, one of the things that we've been talking about in how we form our narrative story is how can we translate that for our own advocacy at local level, state level, and even federal level? How how can we use what you've shared with us today in those ways, and maybe how does your organization also do that type of work?
Yeah, I'll talk broadly and then give you examples at County Health Rankings for sure. And so yeah, so we've seen where people have so we have a transformative narrative for health equity. You can actually find that on our website, where people have then taken those narratives or those value statements and then applied them either local, state, or federal. So either in their community health improvement plans has been like the easiest way to like marry narrative and strategy, and that's local and state. Folks have done media campaigns. One in particular had to do with healthy co-parenting, and the importance of Black fatherhood. And so how to then use narratives and the transformative narrative to then amplify that into social media posts, into media campaigns, into things like billboards and all that. Um, at County Health Rankings and Roadmaps, we use it in big and large ways. So we've used it as far as like we have a national findings report that we do every year that amplifies really big public health issues and refine them in ways that people can connect dots and understand what shapes health. Um, we do reviews where we're looking to see like our dominant narratives being amplified there. How implicit or explicit do we want to be around a transformative narrative? How is what do we say we want, and is that being embedded into our work? We also have evaluators who have done a narrative audit, and they're in like their second wave of doing that. And so we've been able to look and see again how implicit or explicit are the narratives that we say we want, and we say we want to like amplify those, and are they showing up in our public um, resources? Even how are we communicating about data? And so we've done some work groups around changing data language to reflect more of the narratives that we want to see in the world. Um, we've done it all pretty much with big and small ways to look at embedding narrative into our work.
Thank you so much. Are there other questions from our audience today? If there are none, we want to give a big thank you to Angela for being with us today. The public health nursing section and mental health section of American Public Health Association, thank you so, so much for being part of our Wellbeing Essentials series and for talking about the power of narratives with us today. Thank you all so much.
Thank you.